Hi, this is Ty Austin. Welcome to Epidemic Edge. Today's episode dispels some common myths about STDs, and I'll also share some ways for you to break the ice when talking to your patients about STD screening and prevention. But before we explore these myths, let me tell you a little bit about me and why I chose this topic to discuss. I'm a board-certified physician assistant, HIV specialist, and an infectious disease practitioner. And I've practiced for over 15 years, working with the marginalized and impoverished, and working with community health to advocate for sexual health and wellness. During my experience, I really became passionate about educating other healthcare providers on best practices for STD prevention and teaching better communication techniques to improve the patient-provider relationship. Now, let's get into some facts. Did you know that in 2018, the CDC documented that there were over 2.4 million cases of chlamydia and gonorrhea? Now, that means that during that time frame, 20% of the United States population had an STD at any given period. These numbers alone represent the highest totals for STDs since the Centers for Disease Control actually began reporting this information, and it's increasing at an alarming rate. Now, we can learn some lessons from a state that actually leads the nation in STDs for youth and adolescents 15 to 19 years of age, and that state is Mississippi. More than 25% of Mississippi State's new HIV infections are attributed to this population in this age range. Now, this is mainly due to the low level of health literacy in Mississippi. Only 15% of individuals in Mississippi counties are at a fundamental level when it comes to health literacy. Now, what does that mean? It means that they may have difficulty attaining, understanding, and interpreting health information. And this health information is critical because it allows you to make informed decisions about your health, what type of preventative screenings you may need, how to read and interpret a prescription label, and even how to make and keep your medical appointments and why that is so critical. And these things alone can improve and prolong life. Many providers are very knowledgeable about STDs, but more discussion is needed to help patients understand and begin talking about STD and HIV prevention strategies and the importance of testing, especially in rural communities like Mississippi. Now, today's episode is about fact-checking what's real and what's not when it comes to STDs. The first myth is that if you're not sexually active, that prevents an STD alone. Many people even believe that you can avoid every risk associated with an STD if you don't have certain types of sex, or if you refrain from certain sex acts. Now, the truth is you can actually contract an STD from any form of sexual contact, and that includes vaginal, oral, anal, and in certain cases, you can even contract an STD through skin-to-skin contact. And that goes for certain diseases such as herpes and the human papillomavirus. The second myth is that oral sex is the safest way to prevent STDs. Now, stay with me. These are the uncomfortable conversations that we need to have because guess what? Our youth are already having these conversations amongst themselves. So the onus is on us as healthcare workers to provide a non-judgmental platform for them to have these conversations. Now, the rumor has it that you can avoid an STD if you avoid vaginal or anal sex. Now, while you're less likely to contract an STD when you receive or give oral sex, you can still contract illnesses like herpes, the human papillomavirus, gonorrhea, and chlamydia. The human papillomavirus is a common concern that's associated with oral sex. Certain strains of the human papillomavirus can increase your risk for certain types of cervical, anal, head and neck cancer, and they can also lead to genital warts as well. Mississippi has the highest and leading cause of cancers in young adults aged 16 through 25. Now, this is important because only 30% of adolescents in Mississippi are up to date on their human papillomavirus vaccination series, which can prevent HPV. The third myth is that there's no need to screen for an STD if the patient feels and looks well. The fact is that people from every walk of life, every demographic can get an STD. Your social status, gender, or lifestyle choice has absolutely nothing to do with your risk of having an STD or not having an STD. Often people are asymptomatic and they don't even realize that they have an STD, which they can spread to others. The best way to prevent and protect yourself is by using a condom for every situation and to improve your awareness and understanding, as well as being tested and knowing your status. Now, the CDC actually recommends HIV testing for individuals aged 13 to 65 if they're sexually active. And every individual 13 to 64 should be tested at least once in their life for HIV. There's also recommendations for women who are 25 years and under that are sexually active to be tested each year for gonorrhea and chlamydia. And other tests are also recommended, and the frequency also changes depending on new or multiple sex partners, or if you have a partner who has an STD, you should also be tested more frequently. So there are other things that we can do to screen our patients as well. We can offer hepatitis C testing, hepatitis A and B, and update vaccines and people who are sexually active or at risk for contracting a sexually transmitted disease. We also need to improve the transparency between providers and patients by having the conversation. Now, you may ask, but what can I do? We know the most reliable way to prevent STDs is to practice abstinence. However, you can promote STD education and the use of condoms that reduce STD transmission. You can provide condoms in your place of work, in your clinic or health center, by partnering with the health department through their condom distribution program. And this program provides free condom and barrier protection for STDs. You can have that conversation with that young person that comes into your office for a sick visit or for a medication refill. You can provide a non-judgmental space for them to talk about their new partner and their concern about contracting an STD. You can also have the conversation about vaccines that prevent hepatitis A, hepatitis B, and the human papillomavirus, and ultimately acknowledge their concern about being normal and contextualizing sexuality as part of routine medical care. Another thing that you can do is by joining your local community and partnering with leaders for volunteer and outreach opportunities at community fairs, health fairs, church functions. You can engage local school leaders to provide sexual health education that encourage HIV awareness and prevention. You alone have the capability and the fortitude to get the conversation started. Now, my goal was to empower healthcare workers to ask questions that typically get the cover thrown over them and put to bed. We have to start talking in order to teach. You have to ask your patient, when was your last STD or HIV test? What about your partner? You can even ask if they're sexually active. The more that you have these conversations, the more comfortable they become, and you improve the provider-patient relationship and build trust. We can start these small conversations with one patient and gradually build momentum so that HIV and STD conversations, they're not an uncomfortable stigma, but they're actually a way to fight an ongoing epidemic. Now, thank you for joining me this week. You can meet me here the same time next week as we bring these topics that need to be talked about to light surrounding sexual health practices. And we're actually going to speak to healthcare workers on the front line in rural health and find out what strategies they've used to be able to combat these issues. Here at Epidemic Edge, We're on the edge of a breakthrough for HIV and STD prevention. See you next time.